live in Forest Hills, and my name is Jan Powell. I would say that I noticed the knee pain maybe 3.5 years ago, and I went to Florida Orthopedic, and they were like, oh, it's not a big deal. They didn't even tell me I had arthritis. I was like, okay. So I got some meloxicam, but I didn't use it constantly, just occasionally. Meanwhile, I used yoga to help strengthen the muscles in my legs and around my knees. I actually came here to see Dr. Tommy for something else, and I mentioned I had the knee pain, and he was like, and we have the solution. And I was like, really? What's that? And he goes, walk down the hallway. And I said, I can do that. I can walk down the hallway. So he explained that he was having this space here with you all, and he was like, you should look into this. So it was great. It was perfect. I'm so glad my elbow hurt that day, or I would never have come seeking this. I had no idea there was anything besides potential surgery or cortisone shots. I know people that have had those, and then I found out those are not necessarily the best way to go. There is a more natural way to go, and I would prefer natural and lots of vitamins and supplements and eating healthy than just taking medicine. And I was taking meloxicam every single day to keep the pain controlled. I couldn't walk upstairs comfortably, especially I couldn't walk downstairs.
Wow.
So this has been like a great option to reduce that pain. Other than doing some yoga consistently and seeing Florida Orthopedic and getting prescription to take 15 milligrams of meloxicam. Nope.
No. Okay.
I didn't have anything done besides taking a pill. Oh, and when I'm here, I'm
Yes.
having both knees treated. Yes.
Both knees treated.
The x-ray showed the left knee, which didn't bother me as much, still had a little bit of awkwardness going on. And the right knee, which is the one that bothers me more, was more significantly impaired, although not horrific. So I just didn't want, they were saying I had to have surgery, and I really didn't want to do that.
Right, we have a lot of people that come in that says, that's my only option, and we're like, well, let's try this first.
Yeah,
and they're like, absolutely, because nobody wants to have that surgery.
My knee pain was mitigated by taking medication, but without the medication, which I was taking every day, I would say my knee pain was probably 6 or 7 on my right knee and probably 3 or 4 on my left. Right now, I'm probably occasionally at 1 on my left knee and probably occasionally at 3 on my right, and I'm taking half or less of the medication and planning to get off of it. I walk more comfortably now. I am still cautious because it's still fairly new. I've got the habits of getting up out of a chair more carefully. So I still do that, and I remind myself, you can probably do this without pain, but I have developed the habit over several years of being careful. So I know that I went up some steps, just a few steps recently, and I thought, oh, this doesn't really hurt. So that was great. Yes, I normally wear them if I don't like to shop, but if I have to go shopping, I normally wear them for that. I sit for my job, so I don't have to wear them when I'm sitting. But when I walk in my neighborhood, I wear them, and it's just this sort of like mentally as much as anything, it's like your knees are more secure now. But when I walk around, like if I'm working at my desk and just going to another room, I seem to have almost no pain at all now.
Excellent.
The people. Everybody here is absolutely great. I have never been in an office where everybody from the people at the front desk to the nurse practitioners to you, Becky, to Trace, everybody has been very friendly, very accommodating, easy to talk to. That has made the entire experience something that I have been comfortable inviting friends to check out.
Excellent. Thank you. And we love to hear that. And we love you too.
I had a little discomfort a couple of times, and I of course joked about it and said, "Are you trying to hurt me?" But very minimal. Most of the time, I would say zero pain. A couple times a little twinging.
Okay.
Read the book and then make an appointment. Reading the book was fantastic. It is full of information. It's extremely accessible. As a professional editor, I would say it's one of the best introductions to a procedure I have ever seen anywhere because anybody can understand it. And so reading that will give you the confidence to come in and say, okay, let's talk about my knees. If you're watching this, you have pain, or you have somebody you really love who has pain. And it's always good to look at options that are less invasive and have far less potential to have a long-term negative impact. That's what this is. It's more natural. And so it's an option that should not be overlooked when you're looking at your different options.